All right, Stephanie with the patient story, back with Michele Nadeem-Baker, an amazing CLL patient advocate. And Michele, you've just talked to us about a lot, about your first symptoms, about getting diagnosed with CLL, and dealing with watch and wait, or again, as you said, many people call it wait and worry or watch and worry. But I think what people are going to want to be learning about too is when you actually started treatment, what got you into treatment. And I also love that it actually started with a clinical trial, which I think a lot of us in the beginning are not aware is an option. So again, in 2015, it's about 3 years after you start this watch and wait. What was the catalyst for you to go into treatment?
The catalyst for me to start CLL treatment after having been on watch and wait for a little over 2.5 years was that my white blood count had doubled a few times in values between appointments. Also, my lymph nodes had grown to a large size that was palpable for my CLL specialist to find. My spleen was enlarged. These are all signs. And other blood counts also had either gone up or down to levels that were not within range anymore. All these things that point to it's time for treatment. And by the time for treatment, I was very interested in a clinical trial because at that time, and things have just changed. It's crazy. It blows my mind when I think how much things have changed in 6 years, because I started in late 2015. Back then, there was pretty much the gold standard of treatment, which was FCR, which is by infusion. And it's basically fludarabine. Let me see if I get this right. Fludarabine, cyclophosphamide, and Rituxan. And there was a trial open that I was offered. It was for young, and I'm young for something. I'm young for CLL and fit patients. And here, I was in the gym almost every day. And at that time, actually, I had started running as well. And I fit the criteria. So I went into, and at the time, either they had said it could be curative or to put me into full remission and keep me there. So I was like, yeah, sign me up. So what I didn't realize when I was signing up is that once I read the trial literature, it was with ibrutinib, which became the next gold standard of treatment, which is an oral treatment. So I was on full strength of both simultaneously for 6 months, and then just continued on with the ibrutinib, the oral BTK inhibitor, which many CLL patients out there could be on or had been on or will be on. And it, within a couple of weeks, I want to say almost overnight, I felt like my lymph nodes have melted. And within a couple of weeks, the other thing is I forgot to mention is I had what they call night sweats, which are like hot flashes. And I had them morning, noon, and night. They always ask, do you have them at night? I'm like, I have them 24/7. And I was just a furnace. I froze everyone out of my house, but that is another sign that it's worsening. So that had happened. And I also had another sinus infection from hell, which was the worst ever. I thought I had experienced the worst ever. So these are all signs that they saw that my immune system was deteriorating due to my disease that was progressing. And these are things that do happen to CLL, not all CLL patients, but some. So it was just amazing, that the night sweats stopped within a few weeks. Just so many of what had happened to me seemed to be getting better. But then I started with, chemotherapy side effects that a lot of people have. So it was a bit of a trade-off, but I knew that there was an light at the end of the tunnel for the first 6 months. But my fatigue increased. I also had fatigue with CLL starting, it got progressively worse and worse the closer I got to time to treatment. So that's another big factor is fatigue that I hadn't mentioned for most patients. So by the time I started treatment, I was taking naps every day, which is like against my religion. I always think like, oh, that's what, you do when you get old, but I had to give in to it. And then when I started treatment, I absolutely eventually had to nap earlier in the day because infusion chemo is cumulative. And I was on, and I never thought about it at the time, I was on 2 full strength treatments simultaneously for 6 months. Most patients do one or the other. And yet all of this was happening to my body at once.
Can you describe, because it was the ibrutinib and then the FCR together, what was so the pill was daily, was that right? Or how many times were you
Yes.
getting the infusion over the 6 months?
No stops. It's just continuous treatment. And concurrently, the FCR. FCR was, you would be at the hospital as an outpatient for 4 days a month. And it was by infusion. And that was for 6 months. So it's not like, and it wasn't a full day. Once they figure out the speed of your chemo, of your drip, in the beginning it took much longer, but by the end, I was zipping through it like in 4 hours.
So I know this was a clinical trial. I think you had mentioned side effects, but if you could laundry list the side effects you felt, and more in terms of how you were able to overcome them, right? That would be helpful, I think, for people.
I never stopped going to the gym and working out. I hired a personal trainer because I didn't trust that I would be able to judge what I could and couldn't do. And I still wanted to be pushed a bit, but safely. So I made sure I hired one that had background in a great background in physical therapy and physicality. And I did that 3 days a week and did yoga another day. And every week except my infusion week, I did this. And this was my way to be able to control something. So that was something that I continued. And the other thing about this particular trainer is, her name is Amanda Kelsey, she was able to judge my energy levels. Somehow she was able to read my energy levels and tailor my workouts without my realizing she was doing this, until one day I asked her, just like, how did you know I was tired today? And she would know.
Yeah.
So, and that was great. And then there are studies that show that you have less side effects if you keep active, if you move, some kind of movement during treatment.
Yeah, that could be walking. It doesn't have to be, jogging or full running or any of that kind of stuff, but what feels good for you, but movement. I've heard that many times. Yes, is so good for you. Did you experience the nausea or anything else like that? Any other pain?
I had neuropathy in my feet at times, not constantly, but at times it would hurt to walk. And for those of you who follow Kicking Cancer in Heels, I wasn't able to wear my highest of heels in those days because it hurt too much. But I got to look at them and my hands, and it's happening again now that I'm back on treatment, but I had a hard time holding on to things. Like I remember picking up a jar of spaghetti sauce in the supermarket and it fell out of my hands, of all things to fall. I was so embarrassed, but also this started happening. Hand weights, it would hurt to hold them and I didn't have like strength of grip. So these are pretty common with many chemotherapies. They're not fun ones, but there are worse. My fatigue though was really profound and one of the worst of my symptoms. And I wasn't able to go at my normal pace or even, half my normal pace. And there were others as well. There were a lot of, but at the beginning, I wasn't sure what it was from. Was it FCR? Was it ibrutinib? I also had a lot of dermal reactions. I started breaking out in hives a lot. Redness, red splotchy things on my face. So I had to start seeing a dermatologist, and I learned it's better to go to one that specializes in oncology because they know what to do. So for patients watching, if you can find one, there are only 51 or 52 institutions in the US that have them. And I didn't know that. I was just, again, so lucky to be going to a cancer center. But if you ask a cancer center near you, if you don't happen to go to one, or the one that you do go to, even if it's remote, to ask them if maybe they know of them or they can refer to one that's local for you. It was a game changer because all she had to do was look and in a second know what it was. And from what I understand, various chemos do this. It's not just the ones for CLL. So they do know what to do if it's somebody who understands the effects of oncology, drugs, and your skin. And also I learned how to cope with each of the different things that happened. And a lot of strange things happened. And it would break my heart when I'd see online chat rooms on Facebook and patients would say, I'm going off my treatment because of my skin side effects. And I knew that, and I would feel so badly and try to answer. And I've done reports on all the different things that you can use. And, sometimes it's just a particular ointment. Sometimes, for hives, well, Benadryl is the best, but that knocks me out, but at least they go away. Or then there's some other, now I've been trying to use both. Someone had said a couple of antihistamines can help. So there are different ways, but there seems to be something for almost everything on particular side effects for that. And none of those were, horrible things to do. It wasn't like you had to do anything drastic. So again,
Okay.
being your own patient advocate, pushing, asking, what can I do? This isn't working for me. Can I see someone? What can I have that can help me?
Got it. Okay. No, that's great. Those are great tips, I think, for people. I didn't know about the dermatologists who specialize specifically in oncology, so I'm learning as well. And so, Michele, with this treatment that it was September 2015 to May of 2019. Was it still the infusions, or was it just the ibrutinib?
Oh, to May of 20, yeah. So until March of 2016, it was all. And then at that point, it was just ibrutinib. And ibrutinib you stay on indefinitely. On the trial I was on, because of the cohort, when you're in a clinical trial, and by the way, I so encourage people to go on a phase 2 or later clinical trial, because that means the dosage has already been determined. So you don't have to worry about that part of the trial. If you have choices, some patients have already gone through all kinds of treatments. This would not be a first-time patient. And so they do sometimes go on a phase 1. But for those of you who have never been in treatment, phase 2 or later, and it's like getting tomorrow's treatment today. So for me, ibrutinib had not yet been, it had been approved for relapse patients, but it hadn't been approved for those who have never been treated. So I couldn't have gotten that drug otherwise if I wasn't on the trial. FCR, on the other hand, is not used that frequently. This trial that I was on is now, the results are in after all these years. And unfortunately, I'm one of only a few patients, and I want to say it was 89% of the patients went into the holy grail of CLL, which is called UMRD, which is undetectable minimal residual disease. Of course, I had to be one of the few holdouts. I almost reached it, almost, very, very close, but it put me into a very deep remission, a deeper remission than if I had just been on the ibrutinib. So I stayed on the ibrutinib until I stayed on it quite a while, about 3.5, 4 years, until my adverse events or side effects became so untenable, the fatigue really being one of the worst, because, hey, I still have a lot of work left in me, and I was working, but I couldn't work at full speed, nor could I really work full time yet, as long as I was on it. So I had to, because of that, I took a bit of a drug holiday and stayed in my partial remission until I relapsed last year.
What was your oncologist telling you, or your specialist telling you, in terms of, did she want you to continue on the ibrutinib, or did she understand that your quality of life was just too impacted?
Well, I had mentioned for quite a while about my fatigue, and for quite a while, because I had been, again, I hadn't realized how having both FCR and ibrutinib, and then I was in the first cohort, right? They kept telling me it was from treatment in the beginning, and then after, a year after treatment, and I was still tired, then they started trying to figure out, but it's not like there were other options at the time. And then other options started happening, but the drug was working beautifully. And, other than one lymph node being bigger than it should be, and my bone marrow, that's the other thing. The tests you would ask me before about tests, bone marrow biopsies on a trial are done more frequently than otherwise. Some patients never even have to undergo a bone marrow biopsy, but in the first year of the trial, every 3 months, I had to have CAT scans and a bone marrow biopsy. The bone marrow biopsy is more precise than a blood test to find out what percentage of your bone marrow is infiltrated by your disease. So when I went into treatment, I was at 91% infiltration by my CLL. And when I heard that, I was like, oh crap, yeah, I really should be on treatment, because you still wonder, you want to be on in the beginning. And then after you get used to not being on it, it's like, treatment? Oh my gosh, I have to go on treatment now. It's the irony of this. But in other ways, I was so happy to be on treatment, because for me, I was confident I was getting better versus getting worse. And that is a turning point. And I think it's also when patients have been on treatment, they know what it's like. Like they don't get as nervous, perhaps for the next, as nervous. You still get nervous, but you know what it's like, and you know that that you're getting better. And I know for me, so I finally did say that it was really affecting my quality of life. And that's when my doctor started suggesting I go off of it. And here I felt so miserable, but she wanted me to go off, and I was afraid to go off because I knew I was staying, as odd as it sounds, healthier on it. And we actually had a tug of war with the bag with the ibrutinib in it. I pulled it towards me. She'd pull it towards her. I pulled it toward her. I'm like, but I have to stay on. She's like, no, you'll be okay. And finally, I let her be the victor, because it honestly was great being off treatment. I was able to find out that, yes, I still had energy. That was the other thing, is trying to explain to the doctor the real me that she had never met. Well, she met in the beginning where I was working. I was able to work. Here I am back to work, but able to work tons of hours and still do all sorts of other things. But all they see is a patient, you as a patient, versus knowing. You have to explain really how you are. And I was able to prove to myself, which I needed to, that yes, once again, I could get back to having a lot of energy.
Yeah.
I could get back to pushing myself more.
Right. And feeling more like yourself. And I think that's
Exactly.
ultimately a huge question for a lot of people is, do I stay on treatment? But the way I'm living my life feels so different and so below what I want to be, and versus, do I go off treatment? You lose that, as you were describing, almost security of like, well, I'm under care. I know that this medication is helping me, helping to control the disease. But then you had this burst of, oh yeah, this is Michele. This is how I used to operate. That's such a personal decision. And I think that can only be made by the individual, right?
The individual and their doctor, if it's okay
And their
to.
doctor.
For me, I'm glad I was able to do it. And it was wonderful seeing that I am still the person I thought I was, and I could still have energy, and that age hasn't taken over. Which my doctor kept saying, or the disease, that things didn't change from having been on treatment. Because that's the other thing you don't know. Have I changed? Has it changed me?
I'm so glad to hear that, Michele. And I'm also appreciative that you brought up the age thing, because, you are younger than the median sort of, patient age for CLL patients. And so I think that's an important distinction. Another thing is when doctors are considering different, factors, age and health or fitness is all part of it, because it's about treatment and endurance on the treatment. So thank you for bringing that up. As we wind down on this, you had 2 years of going back to this watch and wait up until last year. So what was it like to then have to hear again, well, okay, now it's time to have to go back on treatment?
So it actually ended up being 2 years before it started being noted as being progressing. But it wasn't time for treatment yet. Again, you have to wait until it gets worse. And it presented itself a little differently this time, and it became more aggressive towards the last 2 months before it was time to go back on treatment. So I have to say I wasn't happy that I had to go back on treatment, but I did know that I would, because it is a chronic disease and the majority of patients do. I was hoping I would have gotten a little longer without treatment. but that didn't happen. So, especially with COVID, right? So I only had when I stopped treatment, it was maybe only 10 months before people went into lockdown with COVID. So I just kept thinking, oh gosh, when am I going to be able to live life? And so that's another reason why I wish it had lasted longer. But I'm back on. I didn't know which treatment to go on. So I did, once again, got a second opinion and a third opinion this time. And I am really happy I did, because the good news is there are so many choices right now to go on, which was so different than when I first went on treatment. There are hardly any choices. And there were so many choices that it was kind of hard to decide. And also there were so many trials. So I opted to go on the next generation of BTK inhibitors, something called acalabrutinib, otherwise known as Calquence. And with a trial, waiting for a phase 2 of a particular trial that my doctor had suggested and that I had spoken to others about. And by the way, the second opinions you get should really be from a CLL specialist, so that they give you, even if you don't see a CLL specialist, I suggest you talk to one for second opinion. So I am considering going on a trial in the future. The original one we thought of, I had an appointment a couple of days ago, and that's no longer one that we're looking at because I am doing so well on the drug that I'm on, but we may add in another drug potentially to put me into a deeper remission again. So that's what's next.
I want to ask really, when you're listening to the second and third opinions, you've got 3 different opinions in front of you about which direction to go. What is most important to you in deciding, okay, this is the path I want to go on? So
every patient is different on what works for their lives or not. I was hoping to have finite treatment. That's not important. That's not as important to others. Some people are fine staying on indefinite treatment, and it's easier for them really to just, you take a pill. It's much more serious than just taking a pill like a vitamin. I don't want to minimize what it is, but for their lifestyle versus having to worry about infusions or worrying about being overnight in the hospital for any particular treatment that you have to go through or from being monitored. So for me, I really did want finite treatment, and that's not what I have right now, but I'm doing really well with the drug I'm on, which is wonderful, but I would still love to have finite treatment. So the things you have to look at is what's right for you, what will work for you, because what works for me may not work for someone else. And again, some of this has to do with how many times you've relapsed, or if you're new to treatment. It has to do with certain treatments. It depends on your genetic, the things that we were talking about before, your prognostic indicators, those are like 11q, 17p, TP53, IG, HV mutated or unmutated. So I don't have the worst, but I don't have what they call the best. So I'm somewhere in between, and I have 2 of those. So that does help determine. And then some patients, like I said, one works better than the other. So, and there are all these combinations of treatments on top of that, like endless combinations and endless trials, which is really wonderful for us. No cure yet, but a lot of the specialists say there will be a cure for us to look forward to. And I do hope for that.
Absolutely. And you would know, it's reassuring because you talk to a lot of these specialists, both personally and professionally. And so I think that's going to give so much hope to people. And we're lucky to do the work with you too at the Patient Story. So thank you, Michele. My last question for this.
Love it.
Oh, good. my last question on this is, you talked about acalabrutinib or Calquence. What is the regimen there, and what has it been like in terms of side effects, quality of life, and what's helped you get through some of these side effects, if you have any?
Ibrutinib, you take your pills once a day. Acalabrutinib, you take it twice a day. And for me anyway, different patients have some, sometimes they take less. And my quality of life, other than in the beginning, there were sometimes side effects on this that go away. And in the beginning, just like most patients, I had horrible headaches, but not all the time. And they go away within a few weeks. And if you drink coffee, which I try not to later in the day, but if you drink caffeine, the headache goes away. And they know this now because the drug's been around a while. So it's like, okay, that worked. Or take Tylenol. It's like, okay, that's good. It has less side effects than the ibrutinib because it is a newer drug, less toxicity. But I have only one other real side effect, and that is, and we're unsure if it's neuropathy or joint pain, and that's in my hands. So that's something yet to be determined, and that too could go away. So I'm hoping for that.
Perfect. Well, before we move to this next segment, I just want to say thank you, because huge takeaways are messages of hope and how there are so many options that are out there now. And you're an example of using a clinical trial first, to expand your options. And so thank you for sharing your experience, Michele. And I'm really excited. So this next segment, the final segment, is really about finding your purpose. And so stay tuned for that.